All right, good morning, and thank you all very much for joining us for this presentation. Part of Kerby Center's Live Well, Be Well ongoing series of online mental well-being presentations, provided with the support of Ecclesiastical Insurance Community Impact Grant and the United Way, Calgary and area. Before we begin, as we gather here today, it's vital we also remember the peoples who've gathered here for millennia. This is the Treaty 7 land of the Indigenous peoples of Southern Alberta, the Blackfoot Nations of Siksika, Waikani, Kainai, the Tsuut'ina First Nation, the Stoney Nakoda Nations of Chiniki, Bearspaw, and Wesley, and the historic home of the Northwest Métis and Métis Nation of Alberta Region 3. It is with the goal of reconciliation that we acknowledge the land on which we gather and thank the elders of these nations for their timeless contributions to this land. It is a particularly meaningful day for us today as we're kicking off Mental Health Week and a week-long series of presentations by professionals dedicated to various mental health issues. When one thinks of mental health, the immediate thought goes to isolation, depression, anxiety that we're all experiencing as a result of the pandemic and what we've been through this past year. However, there are many facets to mental health: addiction, abuse, dementia, anxiety and mood disorders, schizophrenia and psychotic disorders, suicide, eating disorders, and much more. Mental illness indirectly affects all Canadians at some time through a family member, friend, or colleague. In the given year, 1 in 5 people in Canada will personally experience a mental health problem or illness. This year, more than ever, we have come to understand that not being okay is okay, and the value of reaching out and staying connected, something we try to do with this series of presentations. This week, we explore several of these circumstances with professionals who will guide you through understanding the illness and help you to get the answers and the support that you or your loved one may need. Founded in 1918, the Canadian Mental Health Association is the most established, most extensive community mental health organization in Canada. Through a presence in more than 330 communities across every province and 1 territory, CMHA provides advocacy, programs, and resources that help to prevent mental health problems and illnesses, to support recovery and resilience, and enable all Canadians to flourish and thrive. We are so pleased to begin our week with Karen Gallagher-Burt, Director of Philanthropy and Stewardship for CMHA. Karen is an award-winning leader, advocate, and public speaker who takes great delight in encouraging and creating joy wherever she goes. Karen has a graduate degree in social work, specializing in not-for-profit leadership. She is passionate about mental health, social justice, and children. She has built her career through the lens of prevention, early intervention, systemic change, and leads with vulnerability and authenticity. Karen's personal life is what grounds her in work. A life partner of 37 years, co-parent to 50 children, and a friend to many. The time invested in these relationships is what gives her balance and joy. An appointed marriage commissioner, she loves creating beautiful ceremonies and celebrating love. Karen loves costumes, social gatherings, 80s music, scuba diving, and gaming. She admits to having a complicated relationship with coffee and wine. I think we have a shared love there. Karen, this is a particularly busy week for you, launching your Get Real About How You Feel campaign. And people are experiencing unprecedented stress and feelings of anxiety as a result of COVID-19. The theme of your campaign being understanding our emotions. What can we do to help us to maintain good mental health?
I love that question to start off with, and I appreciate you saying that as you began the introduction, and you talked a lot about a lot of the illnesses that we all understand, know, or at least have heard of. Our focus this week really is on not talking about those, but talking about mental health and mental wellness. If 1 in 5 of us experiences a mental health or substance abuse challenge in our lifetime, that means that 4 in 5 of us are experiencing mental health. So everyone has mental health and has an ownership in taking care of that, but also reaching out for help and support. That's what's interesting right now, is that we're waiting because some of the folks have started to come for our services, but there's a huge gap of people who are like people attending the hospital going, well, it's not that bad, I'll wait. And that's not what we're looking for. We're looking for folks to be proactive and say, hang on, I'm not as good as I used to be. Something's not working right. I feel like the word that's used right now is languishing. I'm not sick, but I'm not well. And that's what we're trying to address, is the folks that really on a regular basis have fantastic coping skills and really good resiliency, but it's been so long. 15 months is a long time to be isolated, and the light at the end of the tunnel keeps moving. We think we see it and it's almost there, and then it moves a little bit further, and that for us is exhausting, for all of us, absolutely exhausting.
You're absolutely right.
So with delight, I'm going to pull up my PowerPoint and hopefully walk us through a few things that's going on right now. I am so pleased to be here. I was just saying earlier to Colleen and to Vanita that I'm doing a lot of these presentations for corporate worlds and a lot of high-powered individuals and companies. But the reality is, my favorite is when I'm addressing and working with community folks who are just like me, maybe working, maybe not, maybe retired, maybe not, but they're living their everyday average lives. And I think average is a great place to be. And we're the ones that are struggling a little bit more, especially if you're a caregiver. So I'm going to pull up a PowerPoint and walk through it, but I'm going to ask that you, more importantly, pay attention to kind of the words and the thoughts as they resonate for you, because I think that's what's really, really critical right now as we talk about getting real and about paying attention to what you have going on and what you can own. And a lot of time we spend focusing on other people, but today I want you to focus on you. And I want you to focus on self-care for you, a little self-compassion for you. And we're going to walk through some of this material together and make some space at the end for not just conversation, but Vanita will lead us in a bit of a peer discussion. So why is it so important to talk about mental health right now? 𝐇𝐨𝐩𝐞 Calgary, as described by Colleen, has been around for 3 years now? My goodness, we're old. But that 103 years has been an evolution of our work. And as Colleen talked about, over 330 locations, we all come under the umbrella of the mothership in Toronto. I like to think of it as like Star Trek, that we have that big ship in Toronto, and then outside of it, we have all these other little ones, but we happen to be the Enterprise because we're the ones that are doing some fantastic work in Calgary. But Calgary here specifically, and across the country, this is what we focus on and is our vision. We're hoping to help create a place and space for mentally healthy people in a healthy society. We can't always speak to the healthy society, but the more we speak to those who are mentally healthy and support them, the more we can move towards this vision. And really, it's about reducing the impact of mental disorders and addiction. But on the flip side, it's mostly about promoting the mental health, wellness, and recovery. And that's why I'm here today, to talk about that. So we have to narrow and talk a bit about mental health versus mental illness. And always mental illness comes to mind when we talk about someone and their struggles or their challenges. And I like to think of it being a bit of on a continuum of the work. And I always love this kind of quadrant space where you can sort of see, where am I at now? What's not really working for me? And our ideal goal is to be in that optimal mental well-being without a mental illness. So that top right quadrant is where we all strive to be, having a high level of well-being, no mental illness. But I would suggest that right now, here in our world as it sits today, most of us are struggling in that bottom right corner. We're sitting in a place where, you know what, we're okay mental health wise. We don't really have an illness, but we don't feel well and we're not doing well. And I think that's why this conversation is so timely, so very timely, because we often separate ourselves from those folks with a diagnosis versus those who don't have one. So during this time of COVID, maybe you didn't go see your doctor as much as you probably could have or should have. Maybe you've missed some of those things. But I think it's important to talk about how we're struggling. And if we're talking about this with both the professionals, such as our doctors, but also with our friends, our peers, maybe a faith practitioner that's in your life, folks that can support you in this particular, I guess, understanding of where you are in your well-being. So if you feel like you fit in that bottom right quadrant where not a diagnosable illness, but you kind of have a low level of mental well-being, welcome to COVID. I think that's where we all live right now. So I want to show you this chart briefly, and I love this chart. It comes from the American side of things, but it's very much about mental health and how we support particularly the response to disasters. So this chart is always used when we describe what a disaster looks like in community. And I would suggest that here in Canada, based upon our law, there are 3 areas where I think the government has a right to intervene in our lives. And those 3 areas are to do with the health and safety aspect, they're to do with a war, and they're to do with a natural disaster. So all of those things that are kind of beyond our control are the areas where necessary the government can step in. And when I hear those words, as someone who's always touting my personal rights and my personal values and feeling very strongly about it, it comes down to being a collective society to support one another, to not just be thinking about yourself, but be thinking about others. So when I share this, I also want you to layer on mental health in terms of, as I walk through these 6 different phases, everything that's happening in the mental health world is probably following 9 to 18 months behind what we're experiencing right now. What we know from all kinds of pandemics or natural disasters is that the mental health side of things doesn't start showing up fully till approximately 12 to 24 months afterwards, 18 months being that sweet spot. So even though we're 15 months into COVID, we haven't really even begun to see the mental health ramifications that we're going to have as a society. So what I love about this chart is, for me, it's really easy to plot what happened in COVID in terms of the disease and the pandemic, and then talk about the mental health side. So on the left-hand side, you've got the emotional lows at the bottom, emotional highs at the top, and across the bottom is a rough timeline. So I would say that the pre-disaster part of the pandemic happened last year, 2020, in about January. And we all started to hear little bits in the news. There was talk about a new COVID that had arose in Asia. And then it quickly flipped over that there was some happening in the States. It started in the northwest part of the States. And then we started to see little pockets all around. It was early March when it started to be in the big cities, such as New York, Toronto, when we started to really see cases start to escalate. So that pre-disaster phase was kind of January, February, and March, we started to get into, okay, something's happening here. And for me, the world changed on March 13th. March 13th was a Friday, ironically. And on that Friday, it was a decision at CMHA that would be the last day for a long time that we would be in the office full time, that we were going home and we were going to follow the health protocols and figure out what life looked like as we supported ourselves and our community in trying to keep everyone safe. At the same time, we had group homes that we still had to run. We had frontline staff that were part of that. So we had to start following the protocols very tightly in all of those homes and those situations. So it wasn't like we all went home and we stopped working. It was we all went home and figured it out. That was the impact time. The media was crazy. We saw all kinds of things about what was going on. Again, skyrocketing, and I use that word very deliberately, number of cases. Although if we compare it to today, it wasn't so bad, was it? So when the impact hit in mid-March, we all kind of went into a lockdown mode and panic. And then I remember the shortage of toilet paper. And then from there, we moved quite quickly into a heroic stage. And the heroic stage always happens when those who are having some privilege and some ability to be stable in whatever the circumstance. So I think of the flood here in Calgary. I wasn't impacted by the flood directly, but lots of my friends and family were. So for me, I could turn into a hero from the extent of offering my time, offering my resources, offering my hands in order to help people with their situation. And hero stage in the pandemic was, my best example is the number of dentists that contacted me at CMHA to say, we're shut down. Can you use my masks? Can you use my gloves? And we happily said yes. And we're given a number of dentists gave us all of their supplies in order to support our frontline staff. So that was just one example of hero. The honeymoon phase was kind of over the summer, and that's that community cohesion. And what was beneficial about that was that it was bright outside. We had a really good summer last year. We all got out walking. We all committed to some health and wellness. We saw our friends at a distance or in a park or in a yard, maybe in a patio. We went for walks, and we really had a bit of a honeymoon over the summer, I would say, where we were able to support one another, but we felt like we were getting some connection. And then something changed right there in the middle when it said a trigger event happened. And that trigger event was when our children went back to school in September. And when the kids went back to school, whether you have small humans in your life directly as grandchildren, as nieces, nephews, whatever that looks like, when the kids went back to school, everybody's fear escalated because we were concerned about transmission and what that would look like in schools. And we started to see some transmission, and we started to see that off again, on again within the schools. So that was the first hit for that trigger, but it was the beginning of the longest stage, which is disillusionment. And unfortunately, that's where we still are today. And on the bottom there, it shows that disillusionment can be up to 1 year. I would suggest in this case, it's going to be about 18 months. So disillusionment didn't really start until September last year. And I don't think we're out of that stage until probably spring of next year in terms of the mental health, just the subtle ramifications for all of us, but also how we respond to the pandemic. The good part is there's always a reconstruction phase. And for me, reconstruction doesn't just mean some of the physical realities. It's 100% about who we are as people. It's our time to reevaluate, our time to refocus, and truly our time to sort of say what matters to us, because as life will never quite be the same again, there are some good to that. There are some good things to that. One of my best examples is that I don't think I'll ever work full-time in an office again. There'll be some modified workplace, and that's good for me, because those days I am at home, I take care of my wellness much better. I go for walks in the lunch hour. In the mornings, I can spend 15 minutes doing yoga. I only have to get half dressed. I don't have to wear pants. I am wearing pants. But those kinds of things that really make my life a little bit easier and a little bit calmer now, working from home a couple of days per week. So there are benefits as we go through this and as we reconstruct and take a look at what's going to come for us. But that being said, that reconstruction phase also starts to begin that mental health side of things. And it also becomes, very importantly, the time when we start to work through grief and loss, because we're all experiencing grief and loss. That's the theme of 2020. You may have experienced a loss of a loved one or a dear friend to COVID, to the disease itself. You may have experienced someone who has had COVID and is struggling as a long hauler, as they say, or maybe that's you. Outside of the illness itself, it is the grief and loss around our relationships, around how we live. Maybe it was an event that was supposed to happen, the best trip ever, a wedding, a christening, a funeral. All of these things that we were going to experience last year that have all changed, that we haven't been able to have, we bottled it up. And right now we're all weighed down by grief and loss. And for me, this was my biggest learning last year when I talked about how I was doing mentally. I was busy, I was focused, I was employed, trying to keep my family safe. And I started to sink down a deep path. And I'll share a little of that as we go about how difficult it's been for me as someone who describes himself as highly resilient, highly joyous, able to truly see the good things coming. I've had a hard time seeing the end of that tunnel. And I keep thinking that light at the end of the tunnel is a train. And my mind has gone down that direction, and I've had to support my mental wellness in many different ways, some of which I'll share today as examples. So think about that, the grief and loss, and perhaps there are 1 or 2 or 3 things that come readily to mind about something you lost last year, or something that for you was so important to experience that was taken away. One of the things that I'm privileged to do is go every year, pretty much, my husband and I go away to somewhere warm for a week or 2 in January. And I don't know that we'll ever quite do that again. But we missed that holiday last year, and I'm feeling very selfish and privileged when I say that, but that holiday is always a rejuvenation time for my husband and I, as we both have busy seasons in the summer, and in the winters, early fall, we needed that break, and we didn't get it, nor did we take days and stay at home. We just kept working. So what are you experiencing for grief and loss? That's something that I would love you to be able to share. So when we talk about wellness and consider it within the pandemic, these are the 7 different areas that, and you'll see many different examples of this. Some will show 5, some will show 9. We focus at 𝐇𝐨𝐩𝐞 on practicing wellness in these 7 different areas. And I will say right now, you will never, ever find balance. You will never find where this is evenly distributed, where you have the exact amount of attention being paid to each of these areas. It's just not reality, and it doesn't happen. Maybe for someone who posts it on Instagram or Facebook, but we all know that when someone says they're that happy, they're probably telling a lie. So when I look at these different aspects during COVID, it's been which can I manage and which can I control? What do I have control over and what things I don't? And probably the biggest challenge has been there are a lot of areas where I haven't had control. So when I look at the environmental side of things, I can control my tiny environment in my home. I can control my environment when I go out into community and practice things safely. Outside of that, as we all see through the media, we don't have a lot of control in what's happening in the world around us. So that's made us very, very frustrated, but it's also made most of us very anxious. The occupational side, I think that that's different for everyone, whether you're retired or not, you still have to occupy yourself with certain things. And I think much of that has been challenged. As again, I mentioned our workplace at 𝐶MHA, very different environment. The intellectual side, that's always a part of it, whether it's intellectually inspiring your brain every day with something on the computer or reading things that are of value, not social media. But I think for me, the intellectual side has been invested in learning about the pandemic and learning about viral diseases. But also on the other side, I didn't take on that challenge of learn how to bake bread until actually a month ago. I did learn how to bake bread, but I instead took on some creativity things. What kind of things could I do that were reasonably priced that could kind of get that brain flowing, but also pull a bit of artistic in with that. But the ones we've had the biggest impact have been on our emotional side, our physical side, and our social. And those are the things that for us at 𝐶MHA are the foundation of mental wellness. And we put them in 3 other words that I'll share a little bit later on, but really that ability to connect with other people, that ability to be emotionally vulnerable where necessary, but also that combination of physical space and physical exercise, which many of us has either stopped doing, maybe we started doing, but we've had to modify based upon the pandemic requirements. So that physical side is really critical. I think that the spiritual component is part of the faith that gets us through. And I'm certainly not talking about a religion here, although that might be your practice. For me, spirituality is very much about what gives you that strength. What is it in the world around you that you can see has an impact on you and your well-being? How do you feel connected to the world around you? So my spiritual space has always been the mountains or the beach. I like being out in nature. I like these beautiful moments. And so spiritually, I've struggled with getting what I need because I really don't go to the mountains very much anymore. It's a little too busy and they don't want us to come right now because it's not safe. So my spiritual side has certainly been impacted in what I do, but it hasn't been impacting how I think. And that sort of kept me grounded through all this time. So these are the different 7 areas. Again, we may not be, I would suggest we're not balanced in all of them, but always striving for at least having some presence of all of these within your life in a conscious way, not just an unconscious way. So how do you manage this? How do you go through some of this? We talk a lot about how you can reframe the thoughts that you have. And you'll notice I chose many animals here because my dog and my cat have been part of my mental wellness for this last 15 months. So when I think about reframing my thoughts, I think a lot about what comes at me in, say, the media. And I listen for language that comes, and it'll be something like cases in Calgary are skyrocketing. And when words like that are used in the language of the media, they're trigger words for many of us. And they amp us up and they sort of say, you know, oh, that sounds really terrible. Skyrocketing is much worse than increasing. And when we listen to that language, and it pulls us into a heightened state of anxiety and awareness. So for me, it's a lot of trying to reframe the thoughts around that and say, okay, yes, maybe the numbers are up here, but what are we doing right? What are the things that are changing? What control do I have? What can I do differently? And how can I think about that in a way that's helpful for me, for my health, my mental health, but how can I think about it in a way that's also helpful for others? What kinds of compassion can I provide? Empathy. And I try and change the thoughts and reframe them and use different words in order to see not necessarily a positive, because it's not going to be all positive, but to be able to see things from a realistic perspective. I used to love this old adage about Pollyannas and someone who's very optimistic and very pessimistic. And when they look at the glass, they think, is it half full or is it half empty? Well, I'm a pragmatist. I think of that glass of water and I think, well, with someone drinking from it, that means it's half empty. With someone adding something to it, that means it's half full. So it's being able to reframe how you look at that and not say I need to be an optimist or I'm a pessimist, but to be able to look at it logically and reasonably with good information to see things from a different perspective. The other part of that is seeking support and asking for help. This doesn't mean official necessarily. For some of us, there's that go-to friend. There's that one person that we know will support us that's a really good listener and not an advice giver. They're that one person who wants to hear what's going on for us, validate it, and help us find our own solutions. Asking for that kind of help is critical. And if you don't have that one or two human beings in your life, it's potentially reaching out to some of the other professions, whether it be your doctor, maybe you have a counselor like me, or maybe you use the crisis lines, which I have used when I need to talk to someone at 3 a.m. and my friends probably wouldn't welcome a phone call. I've called the crisis lines. And a crisis can be different on any given day. I always say some days my hair doesn't go right, and if my emotional state's not good, that's a crisis. But most days, a crisis for me is the thoughts that are in my head that I can't settle, are the thoughts that continue to run on and keep me awake at night. That's the times when I think I need to talk this out with someone. I don't want to wake my partner up. So I call the crisis lines, and I use them here in Calgary. The other part is keeping your focus on what you can control. And this for me has been the resounding behavior that has allowed me to step back from anxiety and worrying. I do a lot of worrying, which is absolutely a waste of energy. My anxiety and my fear increases all the time. As I leave the home to go do something simple, like get groceries, I follow my protocols. I get my hand sanitizer. I have a clean mask. I do everything before I go in. But before I walk in that front door of the grocery store, I can feel my breathing quicken. I can feel my blood pressure go up slightly. I start to breathe through my mouth, partly because the mask is on and partly because I'm a bit panicky. And I realize that that's because I'm worried about the things that I cannot control. I have to reassure myself, you know what, the grocery store is following the protocols. I can see the people walking around wiping things as we go. I'm following the protocols. And the odd person that's going down the aisle the wrong way, I try and find that compassion for them in that moment. Not always successfully, but I try and do that. And I focus on what I can control. I can control my behavior. I can control how I treat other people, and I can ensure that I minimize what's going on in my brain and that worrying. So that being said, I think resilience has been our key. I think Calgary and all around Alberta, I think we're the most resilient people. Right now, we're not all behaving well, and I would say that's a little bit further outside of most of the big cities. But there's lots of folks who are struggling with the restrictions, and they're really seeing a tough time with what's going on and how they need to live. And I understand that completely. But I think that what we have here in Alberta is this absolute resilience and this ability to truly pull ourselves up after we have a crisis involved. I think about resilience when they talk about that elasticity, that ability to recover and toughness. But the two quotes that I have at the bottom for me are what really makes it sense. That resilience is that core strength that we have that helps us bear the burdens of what's going on for us. I've heard it described by a trainer when you're trying to exercise and get healthy. One of the things they work on right away is your core. And they talk about the strength of your stomach muscles, your back muscles in order to support your whole body. And I think resilience is that's our core for mental health, is that ability to support yourself, to look at things realistically, and then figure out how you can best follow that pattern. It really is that ability to bounce back a little bit and to grow despite the downturns. I remind myself often, and this is definitely not my quote, that I have so far survived 100% of the worst days of my life. So far, I've survived 100% of them. So my numbers are pretty good. And I think of other people and I say, you've survived all those things. You just have to keep going. And there is that light, and it is a moving target, but it's still there and it's coming. One of the ways I focus for sure. So what makes it so critical right now, and how do we get our supports? And I know at the end of this conversation, we're going to talk a bit about peers and about peer support and how we can support one another. And that is magic. That is gold for us. So I always think of what the power of both a friendship is, but then the power of a peer. And they're not the same. So the friendship side of things is really about someone whom you're engaged in a true reciprocal relationship where you share, things that you like to do. You share hobbies and passions, perhaps, maybe interest in certain things. I love to go out for dinner. I remember what that was like. And I have some friends that we like to explore new restaurants. So those are people I do things with, and I do them with purpose and usually for fun. A peer is slightly different. While they too can provide friendship, the other part is usually about the training that they have. And that for me is critical, the training that they have in order to support someone else. And at 𝐶MHA, our peer support program is fantastic. We graduate a group of people every year that are trained to be these peer supporters with their personal experience. And I think that's the most powerful thing that you can offer right now is your personal vulnerability and your personal experiences as you've gone through things. And a peer has that, plus that level of training. Some of the keys we learn in peer support, and I think this goes across the board for friendship, are how to be good listeners, how to be supportive of someone else, and then to know where your boundaries are to support someone and where you really are getting out of your comfort zone or potentially the safety zone for someone's mental health. So the number one key for supporting someone else in my world is about paying attention and observing. I am a terrible multitasker, and I am the worst at it at home. And frequently I have to remind myself, and sometimes my partner reminds me, to put down my cell phone, to stop looking at my laptop, and to focus on being in the moment, paying attention to what's going on. At the end of a busy day, I come out of my office, I still have another laptop in the living room. And I sit down and I'm checking things on social media, I'm doing other things. And my partner is sitting in the chair next to me saying, hello, I'd like to see you. I'd like you to talk to me. And for a long time, especially at the beginning of the pandemic, he did not get my full focus. So right now it's about paying attention and that observation. And when I say observation, when I'm talking to someone, I am looking at them as a whole person, and I'm looking at how they are actually doing today. And we're going to talk about that language. The other part of that paying attention is providing active listening. At the end of the day, I've been on Zoom all day long. I've been talking to people. I don't want to talk to anyone, quite frankly, except my dog. And that end part is really about listening to my husband and his day, and him saying to me what's going on for him as he works on his own and he has his own company. His day is very different from mine. And often at the end of the day, he hasn't had many people to talk throughout the day. So he's looking for me to be that listening partner. So I have to practice active listening. And active listening is about listening and being silent at times, but listening intentionally, not to respond, but to understand. And that for me is a big change in my behavior, is when I focus on someone, it's being so much in that moment that all I want to know is that how you're doing and what's going on for you. It really is listening to what's going on and then observing some of the things behind them. And as my mother used to say, God gave you 2 ears and 1 mouth. Use them proportionally. So 2/3 of the time doing that active listening, and 1/3 potentially making observations and responding, but always reminding yourself this conversation is about the other person at that time. And it really is, it behooves you, I love that word, it behooves you to focus on what's going on for them as they're sharing. The tough one for all of us is always the no advice part. People don't want to hear what we think they should do. People want to hear that we understand, that we're listening. They want to hear that we're listening and we believe in them and we believe in their strengths. And their strengths are right there, but in that moment you can't see them. The resilience is low. So the no advice part, while it may be difficult, unless someone specifically says, what would you do? Then really they don't want to know what you do. They want you to help them find out what they could do. And so making suggestions or observations or considerations. My favorite language for this is when someone tells me something and I start to listen, I'll start to say something like, you know what, I've noticed the last few times we've been on Zoom that you haven't seemed yourself. Is there anything going on I can help with? And making that suggestion perhaps that, perhaps there's something that you can get for extra help. Have you got any supports out there? So again, not prescribing, but listening. And listening to what's going on for them. And the last part is ensuring that if your gut tells you, or if you have some training that tells you that this person is not doing well and you do not feel you have the capacity or the education or training to support them, is that not letting them go, is that staying connected with them and ensuring that they get a warm handoff, not a here's a phone number, call it, but a warm handoff to another service. So never hesitate to call the crisis lines with someone else. You can call and you can say, I'm on the line with my friend Susan, and Susan's having some struggles, and I wanted her to phone, but I wanted to be there with her. And you can stay on with them as long as your friend is comfortable, as long as Susan says it's okay, but you're doing that warm connection versus just saying, I think you should call the crisis center. I think you should go see your doctor. With the doctor, again, you might not hand off, but you can say to them, you know what, I'd love to know when you book your appointment. And if I can take you or drive you or support you, or even if you want to do afterwards, I'd love to talk to you. So these little subtle things are part of supporting it. Again, in the beginning, we talked a bit about mental illness. And as we all struggle right now, I think these don't apply to mental illness. I think they also apply to our mental wellness. So when folks are struggling, it's not helpful to say some of these things on here. We all go through tough times. You'll be fine. Stop worrying, minimizing what they're saying. And then also that false inspiration. You could do anything you set your mind to. Well, quite frankly, that's bull. I can't. I will never be an NBA basketball player. I'm 5 feet tall. So don't tell me I can do anything I set my mind to. The reality is my mind's not working well right now. And I'm struggling with getting up in the day and getting fully dressed and functional. Never mind being able to say I can do more and I can move out of something. It's not there for me right now. Excuse me. And it's not there for many of us. So paying attention to our language and not minimizing or dismissing what someone's feeling, and using language such as, you're important to me. Your life is important to me. I really want to support you. Don't necessarily use the word help, because help sounds like you're doing for or giving to. Support is that you're doing with and you're sharing and you're allowing someone to have that experience. Letting people know they're not alone, that you're available, and then setting your parameters around that. I tell all my friends, I will be available to you 100% of the time up till about 10 o'clock at night. At 10 o'clock, I got to shut things down. But here's the deal. If it's emergent, you text me and I will answer you right away. You just have to tell me 911, I need to talk, and I'll be there for you, because that's what good friends do. And that's what we need to do to support each other. Important part right now is that last one. I'm here for you. We're all in through this together and we will get through it together. And I think that's a magical place to be, is that being there together and getting through it together. There's no one in this world right now that's not experiencing the pandemic. Every single human being is in some way, shape, or form experiencing this to greater or lesser degrees, but it all is one of those collective and shared experiences that we can never take back. So some of the things that I think are super critical, we have to practice self-compassion, and we do that by practicing self-care first. So for me, the two things are very different. Self-care is really those acts that we do to take care of ourselves physically, mentally, spiritually, environmentally, all those different areas. What are the actions that we take that allow us to feel good in the morning? One of my great things, I mentioned I love my coffee. So in the morning, my husband gets up every morning, he puts on the pot of coffee and he brings me 1 latte, maybe 2 lattes to get me going. That's part of his version of caring for me, but also self-care for him. So I need that to get going in the morning. So someone cares for me. But then through the day, I have to take breaks. I have to allow myself that 15 minutes and walk away from my computer. I'm okay saying to people, I'm turning my Zoom off today. I don't want to be on camera. And it's not that I don't want to see them. It's that I don't want to see me today. I'm tired of seeing me. It's very hard on the psyche to look at yourself all the time in a camera. It's very difficult for your mental well-being. So self-care are those actions. What's self-compassion? Well, self-compassion for me is really how you talk to yourself. It's the things that you say in your head that usually end up on the side of negativity. We tend to be in our head really pulling apart all the things that we have done, haven't done, should have done, could have done, didn't do. We're picking that all apart in our head all the time. And the way we speak to ourselves as if we are failures, is that we are lacking in something. It's a negative space, and that we feel that the behaviors we have had are not something of value. And we would never speak to other people the way we speak to ourselves. So self-compassion for me is changing that conversation. It really is that practicing of goodwill and good behavior, not necessarily good feelings. So it's not about saying I will feel better. It's about saying I am good. I am worthy. I did a great job today. Wasn't perfect, but I did the best I could with what I have. And after every presentation, I say that to myself. I may have screwed up something. I may have accidentally swore, which I do regularly. Oh well. But you know what? I'm real. And I've helped share some information that's helpful. I've helped share that I'm vulnerable too, that I'm having a tough time too, that collectively we're in it together. That lack of being alone means that I can self-isolate when I need to, but I'm not alone and I'm not lonely because I have other people that I can reach out to. So we have to remind ourselves that our kindness and care has to go beyond other people. You actually have to turn it inwards first. I always love the story of remember when we used to go on airplanes? I remember those days. But on an airplane, you get on and the flight attendant, as you get seated, they started talking about the safety training and what you need to do in the case of a water landing or whatever it might be. And when they say that in case the oxygen mask descends from above you, please put the mask over your face first before you put it on someone else who might be vulnerable. And I've always thought as a mom, and I guess I've raised 50 kids, but I've always thought, I don't know if I could do that. I'd probably go for the kid first. And then I was on a flight where the oxygen mask dropped. Had a lot of turbulence and the oxygen mask dropped. And I realized in that moment that if I did not put my mask on first, that I would not be there to help my children. And so this is how self-compassion works. If you can't practice it with yourself, then it's hard to offer it to other people. So pay attention to how you're talking to yourself and being with yourself. So how do we get through this? Well, many of us are getting the vaccines. I have number 1 under my belt. I can't wait for number 2. Very excited about the possibility that has for changing how COVID is being experienced for all of us. So we talked a bit about some of the ways we talk to ourselves, some of the coping strategies. I think community support, and today's a perfect example. We'll talk afterwards, and there's a number of folks in here that are really here to support each other. And we're also seeking support from places like the Kerby Center, from places like CMHA, from places like CARIA. They're reaching out for other supports, and that's important, that you're accessing community support. And if you're brave, and if you're strong, and if you feel you're doing well, it's helping provide that community support, even if it's neighbor to neighbor. It's also about making and understanding what services are available and that they're accessible, that everything out there is easy to find, which we know is not true. We know that to be not true, that when you're struggling with something, it is difficult to find the services you need in that moment. I always will talk about 211 as a place to start. The 211 number is free of charge for anyone. It's answered by a health practitioner, a social worker, psychology major, someone who has an understanding of human behavior. But their key role is to provide you with information, resources, programs for not-for-profits, government, and social services. So everything they provide on that line is free. They don't ever provide paid for services. So it's something that right away is barrier free in terms of the dollars. Doesn't mean there's not a wait list, but there's always something available. And it's 24/7 and it's multilingual. So there's over 150 languages that they can respond in and give you support that you might need. But the key to the vaccine is the bottom 3. And those are the kind of things that I want to really talk about as we wrap up and look at going forward with our conversation. The tools that I talk about, and when I talked in the beginning about what CMHA does, the foundation of our work in early intervention, prevention, and support is creating an environment and building in people their own capacity for hope, connection, and belonging. And I actually think that it has to go in a different direction. I truly feel that connection piece has to come first, which creates that sense of belonging. And those two things together create that magical hope. And it's hope for how we're doing, it's hope for how the city's doing, it's hope for the future and what's going on. But those 3 things are the magical vaccine for mental health, that hope, connection, and belonging. So when I think of how they filter together, again, that connection starts first for me. So what is it that I need in order to feel like I am connected in the world around me, but with the right people in the right places and the right services? So paying attention to where I'm at today. lots of times we get caught in that trap of talking about historical stuff, what's happened in the past. And don't get me wrong, we all have traumas that we probably have to work through, some way more than others. But it's not about comparing. It's about saying, these are the things that have brought me to this place today. And right now, I need connection in what way? Do you need friendship? Do you need someone to exercise with? Do you need connection with family right now? What is it that you need most important? And once you start to establish connection, and maybe it's some of the groups at Kerby, then you start to have that sense of belonging. You start to have whatever version of a community you look for. And once you've added that magical water, that connection, and that plant starts to spurt from your brain, and which it really is for me, is the hope. The hope portion comes after we feel those sense of connection and belonging. And those are the things that are magical. Those are the things that we can practice on our own. We don't necessarily need help with, because that connection could actually be with ourselves. Maybe we need to do a little bit more of that right now. And then that can help us move towards the space of belonging. So I said that grief and loss was the theme of 2020. I think for 2021, we're going into the R words, not the recycle, reuse, but instead into the resilience, the recovery, the refocusing, and the reconnection. And for many of you, thank you for joining today. And for perhaps it was just as hard as getting out of bed today. And it was difficult to make the time for this. But somewhere in your brain, in your heart, you said, I need to take the time to connect with other people. This is really important. So I want you to think about those 4 words going forward. What does your recovery look like? What does your refocus look like? What does your revalue look like? So there's lots of places to get help. And when I'm done today, I'll be sending Colleen a full kind of resource guide that CMHA uses to be able to share with all of you. And I also want to share for sure our social media. Lots of people do the social media and say, I want more tweets, I want more shares, I want more likes. Well, quite frankly, we do too, but not for the reasons you might think. It's less about who we are and getting exposure for us. It's more about when you share these things, what you say to people is that I'm a safe person to talk to, that I understand a little bit, that I'm a supporter of mental wellness, that mental health matters to me, and I'm that safe person you can go to if it matters to you. I remember when the Meghan Markle and Harry scandals were happening and they did that interview on TV. I did not watch it. I'm not a big fan. I also think that a family who has that much dysfunction should be working on that in privacy, not in the public. But one of the things that stuck with me afterwards is that Meghan Markle had shared how when she was in her postpartum depression, she had been suicidal. And there was a lot of negative backlash on social media about that, and a lot of comments about, she was fake, it wasn't true, things on that line. But the comment that got me the most was someone who tweeted and said to one of these negative people, Meghan Markle will never read what you write, but your friends will see what you put out on social media and they will know that you are not a safe person to go to, and that needs to change. And that for me was magical. So we invite you to follow us on all the platforms. I'm going to look to Vanita and to Colleen because I certainly don't pay attention to the chat while I'm going. And let's move forward from here and see what kind of questions you have and what we can talk about with peer support.
Thank you so much, Karen. That was fabulous information. We really appreciate that. And boy, I really appreciated that echo pandemic chart because that put it all into perspective, as to what we are dealing with here and realizing those ups and downs and, the heroic and the honeymoon portion. And yes, I agree with you. I think that we're a long way away from that reconstruction phase. So
but it doesn't mean we have to suffer. We're there, you know what? It's painful. It absolutely is painful. But just like when you've got a headache, you can take some, Advil or Aleve or Tylenol, whatever it is that might support you. There are things that can ease the pain. And the most important part of it is that connection and belonging.
Absolutely, absolutely. And how we adapt moving forward. It's going to be very interesting to see how we all, I'm sure Vanita will attest to the fact that, like you, last March, we were all put into a position of trying to figure out how we were going to be able to continue to meet the needs of our older adult community. Yeah. And particularly at a time where they were going to be even more isolated than ever. And so, it's been an amazing year of growth and resiliency, as you said. So at this time, we're going to move into our peer group discussion portion of the presentation. But before we do, there's a couple of quick things. Karen, I don't know if you would like to speak to this lovely gift that you have provided.
I will.
Yeah,
I will. So 𝐶𝐸𝐴, I talked about hope, connection, belonging. Honestly, that's the foundation. That's absolutely the foundation in mental wellness. And so one of the things that we purchased, one of the lovely women who's come through our peer support program, and she is one of the active peer supporters. She actually works for AHS now as a peer. She created these packages, and they're called stress cases, but I call them stress-less cases. And each one is slightly different. We have one called hope, one called connection, and one called belonging. I'm not sure which one I gave you, Colleen. It should say it on the side somewhere.
Gave me belonging.
Belonging. Okay, so each of the packages is slightly different. All of them are filled with self-care products that she has either created or sourced herself, and she does a fantastic job. So we have started at 𝐶𝐸𝐴 in supporting her enterprise. We buy many of them. We use them for gifts for things like this, but every new employee at 𝐶𝐸𝐴 also gets one on their first day so that we can talk about hope, connection, and belonging. It's one of our true ways. So I was happy to share one with Colleen. I have no idea how she's going to hand it out to someone, but I know that I wanted at least someone in this space today to be able to have a little bit of that beginning of a self-care practice that hopefully leads to self-compassion.
Absolutely. I'm going to be hard pressed to give it up, but I think that what we will do is at the end of the presentation, we will go to the list of the attendees who joined us today and do a quick draw. And so we'll notify the winner of the package and make sure that it gets delivered to the person. So it'll be our thanks for joining us today.